I, Dr. Patrick Amoth, do swear that...
Dr. Patrick Amoth, who has served as the Acting Director General for Health since January 2020, presented his case for becoming the official Director General. He emphasized the importance of adequately resourcing the Kenya Health Human Resource Advisory Council to fulfill its mandate effectively. The council, established under the Health Act of 2017, is responsible for setting standards for the posting of interns and the inter-county transfer of healthcare professionals.
Focus more on the vulnerable and marginalized population to ensure that they can be able to get the services, and above all, embed quality into the program from the word go, such that people don't just receive services, but also receive quality services.
Dr. Amoth expressed his vision for a robust and resilient health system in Kenya, capable of responding to any outbreaks, pandemics, and epidemics. He also aims to enhance curative services, positioning Kenya as a preferred destination for disease treatment over the next 5 years.
By this, I mean building capacity at our primary healthcare services and having a shift from the current curative to preventive promotive healthcare with a strong emphasis on community health involvement.
Despite his comprehensive plan, he has faced opposition from Dr. Wahome Ngare, who criticized his stance on medical ethics and his handling of the COVID-19 pandemic, among others. Dr. Ngare alleged that Dr. Amoth supports the termination of pregnancies up to 28 weeks under certain conditions, which he argues is against medical ethics. Ngare claimed that in May 2023, Amoth attempted to launch guidelines that provided for medical uterine evacuation procedure, illegally sanctioning the killing of unborn children up to 28 weeks for risky or unintended pregnancy.
It is true there is unplanned pregnancy, but it is a social diagnosis. You cannot terminate a pregnancy because it is unplanned.
Abortion is not permitted unless, so there are circumstances when abortion is permitted. These guidelines were in line with Article 26(4) of the Constitution. They were meant for trained healthcare professionals. They were not meant for the consumption of the ordinary public.
Regarding the COVID-19 pandemic, Dr. Ngare accused Amoth of subjecting Kenyans to psychological torture by indicating that COVID-19 did not have treatment and vaccines would be the only way to return Kenyans back to normal.
Here we are faced with a situation of a rapidly transmissible virus affecting nearly everybody, but more so the elderly and those with comorbid conditions, yet we did not have a template of how to manage it.
The vetting committee also questioned Dr. Amoth on the potential recentralization of health services, which he opposed, advocating instead for supporting counties with adequate resources and infrastructure. The Joint Committee is expected to present a report on his appointment as Health Director General next Tuesday. Ben Kerera, K24, Nairobi.